evening. Welcome to the closing session of our Black History Month speaker series, hosted by the Center for Global Partnerships and Learning at Pepperdine University Graduate School of Education and Psychology. Throughout this month, we have explored resilience through reclaiming our narrative. Black history, Black stories, Black truth, Black power. We've heard powerful voices reclaiming history, sharing lived experiences, and highlighting the strength found in our communities. Tonight, we close this journey with a critical and often overlooked conversation, the narrative surrounding Black mental health, particularly the unique challenges faced by Black men. We are honored tonight to have with us Dr. Erlanger Turner, a nationally recognized expert in mental health and multicultural psychology. As a licensed clinical psychologist, professor, and researcher, his work has shaped how we understand mental health disparities, cultural competency in therapy, and the impact of race-based stress. Dr. Turner is the author of Mental Health Among African Americans, Innovations in Research and Practice, and has contributed to numerous academic publications advancing equity in behavioral health. His leadership extends beyond academia. He has served on national advisory committees and held influential roles within the American Psychological Association, including as the first Black male president of APA's Society for Child and Family Policy and Practice. His expertise has also reached mainstream audience with features in the New York Times, the Washington Post, USA Today, and Oprah Magazine, and others. Dr. Turner's work embodies this year's theme of resilience and truth-telling, challenging stigma, reclaiming narratives, and advocating for accessible, culturally responsive mental health care. Leading tonight's discussion is our dear Reverend Dr. Charlotta Green, who will guide us through this important conversation. Without further ado, please join me in welcoming Dr. Erlanger Turner and Reverend Dr. Charlotta Green.
Thank you, Dr. Lena. Good evening. We are excited for you to be with us in our last formalized conversation in Black History Month. We have other things that we're seeking to do, but we are glad that you're here tonight. I want to thank Dr. Turner for saying yes and agreeing to share his perspectives and expertise with us. We've chosen to close out the Black History Month celebration with talking about Black males. Oftentimes we hear women's voices and we hear about women and all that they do and how resilient we are. And we often miss out on the gift of our men, the voices of our men, the challenges of our men, and how we can support them. And so tonight, we're going to reclaim our narrative of resilience through lifting our males and our male voices and the concerns so that we're aware of how to support one another on the journey to being more empowered as people, more resilient in our storytelling, more importantly, more proactive rather than reactive in the world that we have inherited. So without any other comments, I'm going to turn this over to Dr. Turner.
Dr. Turner, the floor is yours.
Trying to get my slides up. Thank you so much for the invitation today. So I hope that I can speak up for those voices that you mentioned and also leave us hopeful. But I do want to talk about some of the challenges and sort of how we got to this place and what are some of the difficulties for us as men as we cope in this society, especially as it relates to our mental health. So I'm going to be speaking tonight about the challenges, challenging the norms of masculinity to promote healing among Black boys and men. And so as a psychologist, as a researcher and scientist, I like data and numbers. And so I hope that I don't bore you too much as we begin this conversation, but I do think that it is helpful just to recognize what are the ways that mental health impacts all of us, but also how does it in particular impact the lives of Black males in this country. And so if we look at the numbers broadly, we know that from research over the last 10 years at least that about 1 in 5 adults in the United States have a diagnosable mental illness. That is also recognizing that people might be struggling, but they don't meet the sort of the criteria that we set based upon the DSM, which is the manual that we use to diagnose disorders. The other piece that is important when we think about mental health in this country is that males and those from different diverse ethnic and racial populations are oftentimes less likely to get the help that they need. And that is a significant concern because we know that therapy and treatment is available, but oftentimes those that are in most need don't get the necessary care to address those specific concerns. Furthermore, we know that when we look at Black males, the route at which they receive care tends to also vary compared to most individuals. So this is a source from a publication that I wrote a couple of years ago with some of my mentees. And what we know is that for Black males, that when they do receive services, oftentimes it may not be at their own will or their decisions to seek care. Oftentimes it may be under emergency situations where there's a crisis, particularly when we think about mental health as it relates to suicide risk. It may be court-ordered or mandated treatment, and so you're required to go to therapy, but you may not necessarily want to be there. And so that is obviously going to lead to some challenges in terms of how you actually accept the recommendations and the tools that can be helpful for you to address those particular mental health concerns. So one of the things that I like to talk about, especially as it relates to Black men, while we know that there is a what I call a crisis related to mental health in this country, we know that for Black men, they also have some unique challenges as it relates to mental health. We know since the pandemic that mental health concerns have been increasing in this country. That has been happening before the pandemic, but I think living in that particular context, that it also exacerbated and made the problems much more difficult for many people that may have been struggling before for a variety of reasons. Additionally, when we look at sort of Black men and sort of this suicide crisis that we've seen in this country, currently the suicide is the third leading cause of death in the United States among Black males between the ages of 15 to 24. And so just those numbers alone are very alarming when we think about this population, given we know that treatment can be helpful to address these concerns, but obviously if you're not getting that help, then you're at a much higher risk of dying by suicide. We also know there's a disparity in while this exists in mental health broadly, it also exists when we look at the rates of suicide in this country. And so for Black males, they're actually 4 to 6 times more likely to die by suicide, even compared to Black women or Black females. And while I won't get into some of the reasons for that, we know that sometimes depending on the methods used, that there is a much higher risk of sometimes even dying by accidental suicide as well. The other concern that I have sort of looked at a lot over the last 15 years with my own research is making sure that individuals get access to care and what are some of the barriers to that. And one of the things that we know, as I sort of have mentioned before, is that this population has a low rate of utilizing services. And sometimes that doesn't even mean that it's related to the financial cost of it. Obviously, as many of you may know, therapy is not cheap. However, what we see from the data is that even when people have insurance and its mental health services are covered by their insurance, there still is a disparity in terms of those accessing care. And so one of the things that I've tried to get a better understanding about in my own work is what is impacting these decisions outside of just, the financial pieces, potentially looking at some of the perceptions about, therapy not being something that is useful or necessary for Black people. And so those are some of the myths that we have to sort of deal with as well when we look at this particular community. On the, I think, positive side, at least for me, I think we've seen in more recent years where there are more males that are actually speaking up about their mental health challenges. And so I think given access to social media and technology, that there are more voices in this space, particularly males in this space, they're actually disclosing their mental health concerns, and particularly looking at celebrities that may be dealing with mental health. And the reason that I think that this is important is because oftentimes where you may have someone in your community that sort of encourages you to seek out therapy or get some help, but you may be less likely to listen to that person than you may be able to listen to a celebrity that is talking about the benefits of therapy and mental health treatment. And so on this slide, you see there's a quote here, and I'm just going to read it because I think it's really powerful. This was a quote by DeMar Rosen, who's an NBA player. And he noted that, "I watch people suppress their pain with alcohol, which turned them into completely different people, aggressive, emotional, self-destructive. I chose not to take that route, but certainly some players have. My depression forced me to a place where I was confined, quiet, isolated, and over time, that wasn't healthy, really healthy either. Those feelings built up." And so I like to share this quote because I think it really captures the experiences of a lot of men, in that they may be struggling with these challenges. They may recognize that help can benefit them, but we are sometimes taught throughout our lives that we should deal with these things on our own. If we're struggling with something, you should be able to overcome it. And a lot of cultural things may sometimes play into that depending on sort of your own background. But I think understanding that this sort of invisible wound, as one of my colleagues says, is something that a lot of men struggle with. And it's important for us to continue to have these dialogues so that we sort of break this stigma around being able to seek out services to address those particular mental health concerns. So just to talk a little bit more about masculinity norms and mental health, as I talked about on the previous slide, I think that as boys and men, we are oftentimes socialized from a very early age to withhold our emotions and feelings. And even I tell this story sometimes with my friends that I know, even some of my colleagues in the profession, that even though I do this work, and I have been doing this work for a really long time, it also took me a while to get to a place where I even felt comfortable showing that vulnerability. And that is because I think we live in a world where we're taught that, it's not okay to cry. If it is, if you do cry, then it has to be a really difficult situation. Maybe there's a loss of a loved one or a family member, and you're at the funeral. That is an acceptable setting for you to sort of experience those emotions. Sometimes even when there is the ending of a romantic relationship, it's not okay for you to cry. Even though you may feel really down about the relationship, you have to hold those things inside. And so I think for a lot of men, this idea about vulnerability is really hard to sort of get out of this box that society has placed us in. And sometimes, especially in heterosexual relationships, that when men are comfortable being vulnerable, their partner isn't. And so that creates another dynamic and challenge sometimes, where when men do want to be vulnerable, we still sort of contain those things because we don't know if we actually have a space of safety to be able to do that. So those are some other really important things that we want to recognize when it comes to how these norms around masculinity impact men, but particularly impact Black men. And so on the second point here, it notes there is this tendency to minimize pain and suppress those feelings. I think, this idea about like toughness is something that we see often for men. And even when I work with men in my own sort of clinical work in therapy, sometimes it is a challenge to feel like you can even do that in that space, even though that's your space and your time. I think, again, it is, this notion that this is how you should be. And so a lot of times I'm trying to explore with my male clients about where did they get these messages from? Like, who taught them that it's not okay to be able to let those feelings out. And for me, really recognizing that in some situations, yes, it might be adaptive for you to sort of control your emotions or contain those emotions, but you can't do that every day, right? Your body maintains those things inside. And especially when I'm working with some of my teenage clients, letting them know, like, if you hold those things inside, eventually it's going to come out, probably not in the most healthy way. And so it's really important that we sort of break this narrative around, not allow people to be human. And that's the really important piece that I like to sort of touch on, that, emotions are human. It is not natural to have an emotion and try to turn it off in every particular situation and setting that you're in, or it's going to eat your body alive, basically. And that's why we see some of these higher rates of things like cardiovascular disease in men, because that sort of emotional restriction also impacts your physical health as well. And so there's been a lot of work done over the years to address some of these norms around mental health, but we also know that it is really important to have a safe space and an environment where men feel secure to be able to feel comfortable and be vulnerable to talk about their feelings. And so I am really glad that, as time has shifted over the last couple of years, that we have more men in the profession of therapy and doing counseling, but we also have more men that are actually more outspoken about this, because I think it is helpful to see ourselves in other men that are also being vulnerable and being accepted for doing that as well. So I want to take us back a little bit to this idea about the suicide crisis that I talked about before, and I don't want to continue to sort of bring us down, but I do want us to recognize that this is a really important crisis that we want to be able to address, and particularly given that we continue to see increases in Black males, and that increase we're not necessarily seeing in other groups where we're seeing a decline. And so this graph is looking at some data that was published a couple of years ago in the Journal of American Medicine. And what you're seeing as about a 10-year sort of snapshot is that over time, the blue line is sort of the total number. You can see it was pretty steady for several years. There was a slight increase toward the middle of 2018, 2019, but that number has also continued to increase particularly for Black men, as you can see toward the bottom of this graph. And I guess I should go to my next slide. I wanted to sort of highlight that a little bit more. And so while we see some decreases in some populations, there's the opposite that's happening for Black males. And so what is it that is really contributing to this crisis that we see? And as I mentioned before, mental health broadly is a concern with this population, but I think death by suicide is an additional concern that we want to be mindful of. And so I've done a lot of work in the last 5 years or so to really try to understand and explore, what are the things that are contributing to this increase, especially as it relates to suicide within the Black community. And what we're seeing is that, yes, sort of depression and sadness may be associated with death by suicide, but we're also seeing that, some of the key risk factors that we may look at in terms of having feelings about not wanting to live, that's not always happening in the case of Black males. So one of the sort of key factors that we may look at in terms of preventing death by suicide is not often disclosed with this population. And so that puts them at a much higher risk, because even if this person is going to therapy and working on things, they don't have these thoughts about, I don't want to live, I don't want to be here anymore. But then they still end up engaging in some type of suicidal behavior that may result in the loss of their life. And so what we're beginning to see is that it's not necessarily obviously mental health might contribute to it, but it's not necessarily these thoughts about not wanting to live, but it's more so about navigating this challenge of hope and feeling like things are going to get better. And so what you're seeing here, just a little bit more data, is looking at the racial climate in the United States, particularly thinking about sort of the social political climate as it relates to discrimination in this country or marginalization of the Black community in particular. And this data is published every year. The American Psychological Association does a Stress in America survey just to try to get a pulse about, key issues that may be going on in this country. Sometimes it's around sort of election cycle, for example. Other times it's on things like looking at the racial climate within this country. And what you're seeing here is that across the sort of major ethnic groups that they identify in this data, that for Black adults, they reported the most stress as it relates to the racial climate in this country. And that is important because we know that for a really long time that discrimination and racism have existed in this country. We've definitely made a lot of improvements over the years, but it is something that continues to impact, individuals and communities. And that stress that many men are dealing with has a huge impact in terms of their mental health and their functioning within society. And so I wanted to just sort of, I don't know if anybody watches the Super Bowl or is into sports, but this was part of the halftime performance for Kendrick Lamar this year. And I'm showing this because I want us to think about some of the things that I discussed in terms of mental health disparities with Black males, but also what are some of the unique challenges that we experience as Black people. And that's important because those differences can impact their mental health functioning, but also access to care in this country. And so we want to recognize that while we are all human, we are impacted by things that are going on in society, that for Black men, they may be uniquely impacted by some of these challenges, especially as it relates to discrimination in this country, disadvantage. We see that Black men also experience masculinity norms differently. So I talked about that a little bit earlier. And one of the things that the research shows is that while men in general may have these views of conformity to these masculinity norms, that for Black men, they tend to be much more adherent to these restrictive norms around masculinity. And so that also can impact the ways that they navigate society, and especially how they navigate challenges as it relates to mental health. So how can we really address these concerns? While we know that discrimination in this country is something that we've dealt with for a really long time, one of my colleagues who does a lot of work on this in particularly looking at microaggressions, discussed in a podcast that he did a couple of years ago about, we live in a society where racism and discrimination is never going to go away. And that might be a little bit heavy for us, but I think it's also important to think about how we've been able to navigate those things for many years and still maintain some sense of hope and joy in particular in our lives, despite some of these challenges that we experience. And I think for me, as I talk about this topic as it relates to racism and discrimination, we want to recognize that, yes, if you experience it directly in a person-to-person interaction, it can have a huge impact on your mental health. But we also know from a lot of the research that even when you witness this and observe it, either through the internet, through the news media, that it can also impact your mental health. And that's very different than white counterparts. So there was a study a couple of years ago that looked at police violence in this country. And what they noted is that for people who even lived in a state where there was a police killing, that those individuals reported much more negative mental health days, even though it wasn't directly in their individual communities. And so we know that these indirect exposures and even hearing about these events can be really distressing and impacting individuals' mental health. The other piece, just to dive a little bit deeper as it relates to discrimination and suicide, is that there are different forms of discrimination that we want to think about. So obviously, it can look a lot of different ways in terms of you not having access to different resources. We see in some communities where there isn't access to healthy foods, depending on like the types of stores that may exist in terms of proximity to the community. And so that can be a form of institutional racism. On this slide, I noted any everyday discrimination. So that can be any type of discrimination based upon your identity, from your race to your gender. And I think that's important to recognize, especially thinking about intersecting identity. So yes, people may identify with their ethnicity or their race, but their gender might also play a really important role in how they view themselves and how they navigate themselves through society as well. So if we think about our LGBT siblings, that for gay and bisexual men, yes, they may have some experiences as a Black person in this country, but they also may have additional experiences that may impact them based upon their gender and sexual orientation as well. We also see that race-based discrimination is particularly important when we think about how it impacts individuals and risk for suicide. And so some of the research notes that even any type of everyday experience of discrimination is associated with increased risk for symptoms of depression. And again, as I highlighted, when people are experiencing depression, especially Black men, in many cases, they're not getting the support or the help that they need, or they may internalize these things and not discuss them. And so it's going to put them at a much higher risk of navigating this as well. And then the last point here is looking at other everyday types of discrimination. So discrimination from the any other source for an individual. And that can be associated with suicidal ideation and suicidal thoughts as well. So again, wanted to just sort of highlight that there's a range of mental health challenges that men may experience. In many cases, there's these masculinity norms about being tough, not talking about our feelings, and being vulnerable, that also adds to the challenges of actually helping men to navigate these things in a healthy way and getting the support that they need. So I want to talk a little bit, and maybe this will get us to the side about shifting this narrative to a better place and helping men to get the support that they need. This is a model that my colleagues and myself published a couple of years ago, looking at how does engaging in activism to address racism in society, how does it impact mental health of individuals? And I realize there's a lot of things here in this diagram. I won't go through all of them in detail, but the main thing that I think is really important to highlight is that we know engaging in activism can be helpful in a lot of different ways, particularly to make people feel like they have some type of control to address some of these oppressive systems within society. The challenge that can happen when you're engaging in this work is that there is also that potential for you to have some type of negative experience that can also impact your mental health. And so obviously you've probably seen things in the news over the last 10, 15, 20 years where individuals are engaging in some type of activism work, and there may be additional racist encounters that people have to deal with, whether it's harassing the individuals. That can lead to increased stress while you're engaging in this particular environment. It can also lead you to experience anxiety and worries about, is there going to be potential for these even peaceful protests to result in some type of negative event? And so those are some of the things that we want to be mindful of when we're engaging in this work, that yes, there can be some positive benefits, but we may have the potential to experience some type of risk to our mental health and our psychological functioning as well. However, some of the important pieces about doing this work is that we know activism has a huge benefit. So in addition to preventing some of these negative policies and practices in our society and communities, there's a lot of research that talks about how activism is actually associated with a sense of personal significance for the individual. There's more positive affect. You can feel some sense of joy by engaging in community with other individuals that are doing this work. It can also give you a sense of hope. And I think, especially in the times that we're living now, we don't want to lose that hope. And I sometimes have to remind myself that, looking back over all of these movements across history, that my ancestors and your ancestors have had to stay hopeful to do this work to get us to the place that we were in. And so it's really important for us to also maintain some of that sense of hope as well, to be able to continue to fight these things that we're experiencing in society. The other piece that I think is also important to highlight, and this is particularly useful for clinicians and therapists that do this work, and for myself as well, that we want to be mindful about giving people the space to use the tools and the skills that they also have that are unique to them as an individual. And I think sometimes there is this impression that going to therapy is the only way that you can get a sense of healing and improve your functioning. But we also want to recognize that there are some things within our culture, within our lives, that also benefits us, that can be helpful. And so on this figure here, you see this box that talks about culturally centered resilience and protective factors. And it's really important for us to recognize, especially I think for men, that these practices can really be helpful for us to reduce some of the stress that we experience in our day-to-day lives, but also help us to reduce some of the stress that we may encounter when we're trying to fight against racism and discrimination in society and in our communities. And so some of those factors can be looking at things like religion and spirituality. So I think for a lot of individuals, this sense of connection to a higher power, building on those things can be sources of strength for individuals. And so we want to try to, again, as I think therapists and clinicians, to recognize that for people who see their religion and their spirituality as being important, is that we want to empower them to be able to utilize those practices and strengths to help them to have a better sense of well-being for themselves. The other side of this box is looking at culture-centered healing and wellness practices. And I think these are the things that we want to be mindful of as practitioners and therapists, that in doing this work, we want to build on these cultural strengths and integrate them into our work as professionals. So yes, we have some strength as therapists and as counselors and as psychologists, but those things may not be as useful for people who are not seeing their own culture in those pieces. So one of the things that a lot of researchers looked at, for example, is like movement. And so being able to engage in movement can help to boost your biology, is the simple way to say it. And so being able to encourage people to, walk, go outside in nature can be one of those things that you can be able to do. There's been ways to think about how do we move therapy outside of the office. Obviously, in this sort of technology space, we've sort of transitioned to telehealth and doing things online in a lot of ways. But sometimes you can also take therapy outside of the therapy office, and those can be some other ways that we see can be really beneficial, and sort of integrate these cultural practices for some of our clients, where that is also really important as well. So that was a really sort of a high level overview of that model. You can always refer back to that article if you're interested, and I'm happy to, maybe at the end I can post the link in the chat if that's helpful for people. But I want to talk a little bit more about ways to build resilience. For me, one of the things that I try to emphasize with my clients and emphasize in the ways that I do sort of education around mental health is letting people know that resilience doesn't just happen. I think there's a lot of times where we have this perception that, things are just going to get better over time, or especially if we're looking at youth, that because of their development, that these things are going to be things that they're going to sort of forget or leave behind. And we know that obviously, your experiences in your adolescence, childhood maintains and continues to impact you throughout your life as an adult. And for adults to realize that just because you don't talk about a situation, or you decide that, that's something that happened in your past and you want to move forward, it goes with you. And a lot of times I have to encourage my clients to think about, just because you want to sort of file these things and experiences away doesn't mean that it's not there. And so you still have to deal with it. And one of the ways that it is necessary to think about this is recognizing that to be resilient requires action. You have to do something to be resilient and overcome these experiences that you've had in your life. So I sort of touched on this a little bit earlier, but just to sort of bring this up again, cultural and religious beliefs oftentimes can be utilized to discourage engaging in things like suicide, but also thinking about strengthening mental health as well. So in my newest book that I wrote, which is behind me here, which is a workbook for parents to help kids navigate racial discrimination, I talk about ways to use things like Bible verses. So if that's something that is important to you and your family, that can be ways that you sort of integrate those things, in your life as ways to help you overcome some of the stressors that you may be experiencing. The other thing that I want to go back to sort of more broadly about resilience is that this action that you take also has to be frequent. And so I think one of the things that sometimes happens, especially, from a therapy perspective, is that people think that if they go to therapy or go to a session 1 or 2 times, that they should feel better. That's possible that may happen, but in most instances, it's going to take longer than that, because these are things that you've been dealing with for a really long time. And so just because you do this once, you shouldn't expect that it's going to all of a sudden, be this magic pill and things are going to, be better for you. So I encourage people to think about engaging in some type of activity to promote resilience daily if possible. And that can be small things in terms of like giving yourself 5 minutes to sort of sit and breathe where you're not being stimulated by your phones. Or it can be, taking a 30-minute walk or exercise, or it can be, going to the gym. Those are things that you want to think about in terms of having your sort of self-care plan, as I say, to make sure that that helps you to be more resilient to some of these things that you may experience that are challenging in your life. The second point here talks about connecting with family, friends, and community as support. And we know that that's helpful. But one of the things that we see for men in particular is that what that looks like can be very different. Friendships and connections with men are very different than women. So there's this, a lot of conversations have been coming up in the last maybe 2 to 3 years around like social isolation. And this idea that men are much more socially isolated compared to their female counterparts. And I joke sometimes, with people about my friendships with my male friends that, we can probably go like weeks or months without talking, and we're still fine. But I think for women, that tends to be very different. If you go weeks or months, that's probably you're not friends anymore, right? And so I think just sort of recognizing that the ways that friendships show up for men can be very different. We do want to encourage men to find the sense of community and support that they find as being most useful for them, but also understanding that you don't want to sort of push people into doing things or engaging in activities that they don't feel is as helpful for them. And obviously, again, each individual person is unique, and what that looks like, is going to be different for every individual person. It's also necessary to have supportive relationships with care providers. And so I think, for me as a psychologist, this is really important because sometimes when we think about therapy, it's sort of supportive, inherently supportive, right? But I think for men, sometimes they don't find it as being supportive. And that could be related to the ways that we think about what therapy should look like. And especially on the therapist side, that we sometimes lead with talking about our feelings and emotions and why that's helpful. I think for men, when that's not their norm, and they're put in a space where you're now forcing them to like emotionally express themselves verbally, then you get some pushback or you get some shutdown. And so I think as a provider, we want to make sure that we sort of meet men where they are. Some men might be much more verbal or vulnerable or emotionally expressive, and other men may not. And so I think that is important to make sure that you create the space that that person needs to be able to engage in some type of healing and support in that particular therapeutic space. And then the last point is availability of physical and mental health care. So we know that therapy can be helpful. One of the challenges that we see is that at this current time, there is not enough therapists. I actually presented in another space last month, and what I found out is that there are 300 people for every one mental health provider. And that is looking across different professions. It's not just psychology, it's not just social work, it is the behavioral mental health workforce. And so we know that even for men who may be interested in getting help, it might be a challenge to find someone who is a really good fit for them. And in some cases, people may have one chance where they go to therapy, it's a bad experience, and they never go back again. And so I think for us, and I do this myself, that if we have people in our lives, particularly men in our lives who are interested in therapy, they try it out, they have a bad experience, and they're like, therapy is not for me, try to encourage them to find someone else that can be supportive and useful for them in that space. I use the analogy that, if you go to get a bad haircut, you're not going to stop going to the barber. You're going to find somebody else that can cut your hair the way that you want to. And so we need to think about therapy in that same way, that, if you find a therapist that is not a good fit for you, do some more work and find, a better person that's going to be a better match for you to help provide you with that support. And so just to talk a little bit more about some of the treatment considerations. So some of these I've sort of alluded to throughout the discussion already today. But I do think, especially for therapists and mental health providers, evidence-based treatments, as what we refer to, things like cognitive behavioral therapy. There's a lot of research that's been done over decades to say that this helps to improve your functioning. We know that those evidence-based treatments can be helpful, but we also know from research that culturally responsive and culturally centered practices can also be helpful and can be healing. And so we want to try to integrate those pieces in our practices as well, so that people can find the support that they need, and that they feel inclusive in those practices. Because sometimes when we use these evidence-based sort of cookie cutter approaches, that some clients don't feel like that is the treatment for them. And so those are some other things that we want to recognize as well. There's also research that talks about religion, social support, dispositional forgiveness, emotion regulation as strategies that can be adapted for Black men, particularly in coping with things like depression. And so again, even if someone can't get into therapy, for example, you want to be able to identify what are some other ways that people can get the support that they need to be able to get some healing and address those challenges that they may be dealing with. There's also work that's been done over the years to highlight how social organizations, community organizations, fraternities in particular, can be a really supportive space for Black men in addressing their mental health concerns. And so this is just a couple of programs that are highlighted here that have been utilized to address the mental health within Black males. We've also seen over the years where more recently that individuals are provided supportive spaces in barbershops for men to be able to engage in some type of support groups as well. For those that are in LA or may have come across Walk Good LA on social media, they do a lot of unique things for Black men around healing and well-being. I know they do several times throughout the year, they do healing circles and journaling circles for men. And so while therapy can be helpful, we also want to sort of think outside of the box about what are some other ways that men can get the support that they need outside of this sort of traditional counseling and therapy space. So as we sort of get towards a close, and I believe we have some time set up to do some more discussion, I just want to leave us with a call to action. While mental health is a crisis in this country, we particularly see that death by suicide is continuing to arise and increase among Black males. And so I think we want to be able to better identify those men that may be struggling and get them the support that they need. And so I think providing spaces like this and continuing different dialogues around mental health and some of these challenges around like navigating masculinity norms, for example, can really be helpful to help reduce some of this risk that men may experience. The other piece that I think is helpful is looking at efforts through research, practice, and policy to help address this crisis. I've been doing a lot of work around policy over the years around just sort of advocacy for workforce, for example. So how do we increase our workforce of behavioral health providers? In particular, how do we get more Black therapists and clinicians within this profession? A couple of years ago, I want to say I was in the earlier stages of my career. I did some research and wrote an article looking at Black men and what are some of the reasons why they may be reluctant to go into the mental health profession. We see some of the things around masculinity and it's not a profession where I see myself. Some of the challenges around navigating education and providing for themselves and their family. So in many instances, this idea about I need to have a job is more important than me getting my education to become a therapist. So even though this may be something that I see myself doing, there are other priorities that I have to look at right now. And so being able to continually think about what are the ways that we can provide more support and resources for Black men who actually want to get their degrees, how can we provide some financial support and scholarships to them so that they don't have to, give up their dreams or aspirations to provide for themselves and for their families. And then the last piece, which I think is really important, is to continually engaging in community engagement and mental health literacy. So talking about mental health, breaking down some of these barriers, letting people know where they can find help and where resources are available. Many of you may know about the 988 crisis hotline. And even though that exists to provide support for people who may be struggling with mental health concerns, there's an underutilization of that hotline. And so we need to talk about it more so that people know that it does exist and that it is confidential and it's free. If they are struggling, they can get some support in sort of the immediate moment before they can get therapy. So I appreciate you for taking the time to join us today. I do have a poem that I want to recite before we sort of close out. I wrote this poem several years ago, but I do think that it is timely given the discussion that we had today, but also some of the things that are continually going on in our society. So I'll read this. It's really short, and then I'll share a couple of additional resources that might be helpful. Mama used to say, sit down somewhere and calm your nerves, child. As an adult, these words connote the idea of taking rest, to relax, to clear your mind from daily stress. Yet, the notion of working hard and grinding is embedded in our culture. I encourage you to give time and energy to unlearn these decades of pressure. Sit down somewhere and liberate your mind. In 1865, Black people were finally free, in theory, yet we still fight for justice in the present time. Sit down somewhere, at least for today. That's the affirmation, allowing ourselves some grace. There will always be time for you to protest, advocate, and join the movement to liberate. So for those that are therapists, these are just a couple of resources here that I want to share. The first one is a free continuing education course that if you need some CE credits around multiculturalism, that is available. I had an opportunity to work with the Department of Health and Human Services to create this several years ago. So do take a look at that if it's helpful. There's also some additional resources at those other links around guidelines around practice, particularly with diverse communities. And then this slide here is just a couple of book resources. As I alluded to earlier, the first book is my new workbook that I published a couple of months back. I think October was the release date. And so it is Raising Resilient Black Kids. It's particularly geared towards parents to help them navigate these conversations about how do you talk with your kids about it, but also providing some space for you as an adult to think about how do you take care of yourself. So it's hard to talk with your child about these things if you are also struggling with yourself with navigating these emotions and feelings. And so I really wanted to integrate that in there for adults as well. And then the other two books here are also focused more on navigating some of these challenges of discrimination and racism in society. And then the last page is just a couple of mental health resources. So if you know anyone who may be looking for a therapist, these first two websites are some mental health directories that are geared particularly towards diverse individuals. And the second link is particularly geared towards therapists who provide services to Black men. The third link is the group practice that I work with. And so we have therapists that work virtually in the state of California. And so if you know someone in this state that might benefit from therapists and they're particularly looking for a Black male therapist, all of our therapists are male that provide services. And then the last link is just for the National Alliance of Mental Illness, which is just additional resources about awareness around mental health. And so that's it. I'll turn over to you.
Thank you, Dr. Turner. Wonderful presentation, great information. If you will provide us those links, we will put them all in a resource guide that we'll put in Sakai for on our site so that people can access them in case they didn't get them all written down.
Perfect.
Yes, so we're opening up the space for questions now. You know, a timely topic. This is a stressful time, particularly for men. And as you know, we're talking about Black History Month. One of the things that's really key and important as we think about this is the fact that, you know, Black men want to be supportive, they want to protect, they want to provide. And these are all things that are a challenge right now. I see that Kimberly has her hand up, so we want to allow her to ask her question.
Sure. Thank you so very much, Dr. Green and all the other professors and doctors here. Thank you. And also Dr. Turner, thank you for presenting and being the closing keynote speaker. And congratulations on the very, very good work that you're doing in the community and for the society. And for that matter, I believe for the world. I think when you touch one person, it actually circulates all over the world. But I just wanted to get your perspective on, it seems as though that the research now is the most effective way to get our wonderful Black men to feel safe is when they're most comfortable in the barbershops, the churches, sports events, you know, things like that, fraternities. Is that where you think maybe the trend now for the research will come from and moving forward?
Yeah, no, thank you for that question. And also thank you for the kind words. I do think that the research has shown us a lot about, you know, trying to get out of this sort of traditional therapy space is helpful. And so I think along those same lines that we as researchers, but also as therapists, we have to get into the community. We have to partner with these organizations and churches and groups, et cetera, so that way they're getting that support that they need from qualified professionals. Because I think sometimes, you know, it's really helpful to have a space where, let's say the barbershop is a space where people can go and talk. But then, people go and dump sometimes, I think. And like you have all of these emotions that everybody is sort of sharing. And so it's like, what do you do? Like, how do you carry these emotions when you leave that space? And so I do think that it's helpful if we can sort of partner with these organizations to then also provide some tools and strategies for people so that they're not just sort of, being vulnerable and opening up, which is really important and helpful, but they also know what they can do to sort of cope with those things. So I do think that, taking the things out of the ivory towers in these university spaces is really helpful so that we can understand like what's going on in the ground in our communities. Because one of my other colleagues has talked about this idea that, it's not that Black people don't believe in therapy, is that they don't believe in the ways that therapy has been discussed with them or the people that's providing the services. And so that's a really valid point that you brought up.
Thank you. Can I just add one other point that that also in our corporate, sphere, even our corporate professionals, they may still feel more comfortable to then talk about these things in the grassroots environments that you're talking about. Do you agree with that?
Absolutely, absolutely. And I think, I've been in some spaces where I've done some workshops for corporate people around like mental health awareness. And so I think like organizations are recognizing that that's beneficial for people. But we have to be better, I think, as professionals to bridge those gaps and make those connections so that people can get that support in those spaces.
Mm-hmm. Thank you, Dr. Turner. Mm-hmm.
Okay. Ms. Williams, and then I see two other hands, and it's Tolliver and Carey. So we'll go to Ms. Williams first. You're muted, Ms. Williams. Unmute yourself.
Okay, thank you, Dr. Turner, for an excellent presentation. And I just have a question about Black women being, or psychologists, treating Black men. And since I work for the Veterans Administration, I had therapy groups for men, and they felt that they didn't have to be as defensive. They could be a little bit more open. What are your ideas about that?
Yeah, no, that's a really great question. So thank you for that. I think it really depends. So the unique thing that we see is that for some men, they actually feel very comfortable when they're in a space with a female therapist, and then other men they prefer to have a male therapist. So I think that we have to recognize that people need different things. Mm-hmm. And that we don't want to like restrict people to those spaces and try to create spaces where they have opportunities to decide like what's best for them. I think one of the things that I've seen over the years in my own work is like if working in like a training environment where male clients are given to all the male therapists in training. And that's great, but that might not be what they want. So I do think that it is important to recognize that for some men, they actually feel really comfortable, and they may prefer because I think sometimes it's like, well, I'm not going to get judged by a woman, and I might get judged, even though that may not be the reality. They may feel that way, that they may be getting judged in some way by a male therapist.
Okay, and the reality is that all humans were raised by their mothers. They started off with their mothers.
That is
so
true.
It depends on the relationship that you had with your mother. I just wanted to make that point. Thank you.
Yes, thank you so much.
Okay. Carey, do you want to go next?
Sure. Thank you, Dr. Turner. It's such an honor to have you as my colleague, because I always learn from you. I do wonder, are you seeing any shifts in generations? Are younger generations more open for Black men to therapy and services? Is it changing?
Yeah, I mean, I think it is. The other piece I think I've seen too, where for some men, depending on the environment that they lived in, growing up, that they're also much more comfortable and open as well. So I sort of touched on earlier that for some men, they are very comfortable talking about their emotions and feelings. And that can be, it can be whether they were in a single parent household, 2-parent household, et cetera, that they were encouraged to talk about their emotions and not be as restrictive. And so I think that is something that we're seeing, especially now where younger generations, the idea about emotional restriction may not be as sort of a rigid norm than maybe what we saw before. And so I think that contributes to why we see those in the maybe younger generation that may be more open to therapy.
Ms. Tolliver.
Hi, thank you, Dr. Turner. I appreciate your talk. I was wondering how I can get my male child who I birthed, who's 25. I'm trying to get him into the idea of therapy. He's good at telling me his emotions. He comes to me when he's struggling with school and all this, but I can't get him to go to therapy. It's like, do you have tips on how to get him to, because he has the issues that you've been going over. He has them,
Yeah.
but like I can't get him to see it for himself that he needs a therapist, but he's 25, so I can't force him now.
Yeah. No, thank you for sharing that and asking that question. I do think so. One of the things I think can be helpful is helping them navigate that. So while I think sometimes we mean well when we say you should go to therapy, or I think therapy would be helpful for you, people don't know where to start. And so I get that a lot of times where people reach out to me for a therapist and they don't even think about asking, like, oh, people specialize in certain things. So if I'm struggling with anxiety, I may not benefit from a therapist that specializes in depression. And so I think, providing some really concrete things might be one way to sort of help. So if you know of a list of providers, maybe say, hey, let's look at this list together. Let's look at the website together. Let's see, are there people that you feel like you might sort of connect with? That might be a starting point. The other piece I would think about is encouraging people to like give it a try, like try it out. Like you might be a skeptic, but try one session. If you don't like it, then you don't have to go back. Like there is no contract that says you have to go a number of sessions when you go to therapy. And I always tell my new clients, this is as much sort of my decision as it is yours decision. Like if you feel like I'm not a good fit, fire me. It's okay to say I'm not the best person for you. And so I would take that route as well to see if that can be something that can be helpful.
Thank you.
Dr. Turner, you mentioned throughout your presentation the importance of, understanding how, faith or religion play a role in some of the ways in which we talk about our emotional challenges, what we're going through, how then do you help clergy who do pastoral care, but may not necessarily understand some of the unique dynamics of the Black community and Black men, and strive to do the traditional pastoral care things that don't resonate? Like, how do you help those of us that do this, that were trained in a more classical, more Western framing, that is not necessarily anchored in the way in which we engage at a relational level? Like, rather than, looking at all of the symptoms, but it's like relationally, like, how do we help you when that's not their training? So what other than your books, what do you say to clergy who are in these spaces, who definitely need to be able to help people and point them in the right direction from a culturally sensitive perspective, but also the understanding that, even our understanding of the way in which God works and how we utilize religion is very different?
Yeah, I mean that I haven't done a lot of work in sort of that context, so I think it's hard for me to sort of come up with like a clear direction that people should go. But I do think, as you sort of pointed out, that even for me as a psychologist, a lot of my work was very Western. And so I think I tell people all the time that a lot of the things that I've learned about culture and identity have been things that I learned after I graduated with my degree. And that was just the nature of the program that I went to. And so I think from that perspective, for those that are doing pastoral care, that there may be some similarities in terms of like, these were the ways that people were taught, with not really recognizing some of these unique experiences. And so I think it is helpful to try to inform people as much as possible about some of these unique challenges, especially as it relates to identity and culture. And I know that we're wanting to like, I don't even know how to say this right now, but we're wanting to like erase DEI and like what that means. And like, that's not going to change the things that are going on in society. Like, they're still going to be there, whether you decide to remove that label or not. So I think it is trying to have people understand that people are different. Yes, we're all human beings, but we also have very unique experiences based upon our culture and identity. And so how do you be open to talk about those things with your with the people that you're doing pastoral care with, and to make sure that you are able to provide that space where they feel comfortable talking about those things. So for me, it is trying to when I talk about this with my students in my class, it is recognizing that as the therapist, as the pastor, that there is this power differential that's there. Even though we may not want it to be there, it's inherent in that relationship. And so as the pastor, you have to sometimes initiate certain conversations that maybe the person isn't going to feel comfortable bringing up. And so if it's related to their identity, you may have to sort of go there to say, hey, I know that things are tough right now based upon your community or your culture. How are you dealing with that? How can you find some unique support, as opposed to sort of, focusing more on sort of the broader ways about how religion and spirituality may be impacting a person?
Okay, thank you. I've got a couple of questions in the chat that I'll read for you. I was wondering how mental health professionals can build greater trust with African American men who may have had negative experiences with the healthcare system, from Jessica.
Yeah, so for me, one of the things that I try to do myself, but also, again, if I'm doing workshops or trainings for professionals, is to have them be very direct with their clients, to ask about their previous experiences. So the language that I encourage people to use is to say, have there been any experiences that you've had in the past with therapy that you would like to be different? I think that provides an opportunity for the clients to then say, oh, I had this really bad experience with my previous therapist, or I'm reluctant to, work with you because of XYZ. That's a starting point, I think, in many cases. The other thing that I think is helpful is for therapists, especially when you're working with someone that, for white therapists or non-Black therapists that's working with the Black male, is to have an open dialogue about how important that sort of racial relationship is. And so are there any concerns or challenges that you have about working with me because of my identity or who I am? I think it's something that is really helpful for therapists to bring up, so that way, if the client has had a bad experience before with another therapist, that they may feel comfortable to say, I had a therapist before, this is what happened. And then again, that provides a space for you to navigate those challenges together. So that way the person is not on, I hate to say alert, but they're not watching you to see, like, is this person going to be the same person that I didn't like before? And in many cases, if they see that you are, they probably are not going to come back, to your office again.
Mm-hmm. Thank you for that. Are there other questions tonight? This is such rich information that's helpful and timely. Patrick, I see your hand up.
Yes, thank you, Dr. Green. Hello, everyone. Thank you, Dr. Turner. I'd like to ask, I am obviously a Black male. I am also a veteran, and I routinely have, I've been one who has used and think that there's such huge benefits and need for the types of services and mental health tools that are available. I see veterans struggle a lot. I'm a retiree, so as you can imagine, and I think Ms. Williams says she works with VA with veterans. There's usually, I know from being a Black male, I grew up in the South. There's a lot of the masculinity type things you spoke of. I've grown up around it. It's probably on steroids in a military environment.
Mm.
And we oftentimes don't talk, don't trust. And what I've seen is that what we do, those of us that want to ensure that our brothers and sisters are okay, routinely just, if I think about you, I call, some people call them buddy checks or different things like that. My question to you is, I feel as if there is a huge gap between seeing a brother or a sister struggle and getting them to take the leap across that gap to get into therapy. Obviously I can pick up the phone and I can, or I can see them and talk, but there's still that huge gap. What can you recommend, or what would you say is a good way to get a tool, a resource that is something that we can kind of give them to nibble on to kind of get them to not see such a huge leap from, I don't talk about my feelings, I have these, I can deal with it, I can push through, I can suck it up, and so there's a little bit of a bridge before they just go all the way.
Yeah, no, that's a great question. Thank you for sharing that. And I don't work directly with veterans, but what I have heard though is that while many can get services through the VA system, they don't feel as comfortable getting services through there. And so that I think, might be an additional challenge with people, being open to getting some help, is that if the VA is the only place that they can go to get it, they may be sort of reluctant to do so. So I think that in itself might be sort of one challenge. I think there are a lot of, there are some workbooks that are available, like books for, like, I know journaling is not for everybody, but I think it does help people to get their thoughts out sometimes. And so I think there's a couple books, and I can't, I just went blank all of a sudden trying to think about this, but I'll send it to Charlotta and the group, and maybe they can add it to the list for people to send out. But there's a couple of books specifically geared towards Black men that helps them work through and process different things. But I think that can be like one tool, because it at least allows you that space to like get out those things that you're dealing with. And then you can actually use those things to now say, hey, if you want to go to therapy, you can now take this to say, oh, these are the things that I've been processing that I want to talk more about or get some help on, as opposed to like showing up to therapy and like, I don't really know where to start, which I think is the case for a lot of people, especially for people who may be like referred to go to therapy. Is like, well, I was told to come, but I don't really know, like, I think I'm okay. I might have this right here that's not going well. But I think what we see, especially for men, is that in many cases, it's not that just things are not going okay. It's like things have to be going bad. It has to be crumbling before I'm going to be willing to go to therapy. And I think that's the problem for a lot of people, is that they see therapy as like this sort of last resort, as opposed to using it along the way to maybe address some of the ruptures and things that you might be dealing with. And so that was sort of a long-winded response to your question, but I think that, using those types of books can at least help you to begin to process some of those things, to de-stress.
Thank you very much, Dr. Turner.
I see Ms. Williams' hands up, and Kimberly, did you have another question? I thought I saw your hand up as well.
Yes, doctor, I do. And I can wait after Ms. Williams.
Okay. Dr. Turner, I have another quick question to ask you. Since I ride the bus, I'm retired, ride the bus, and I think we're losing a whole generation of young people. You know, I just see them smoking dope. They get on the bus, and you say, "Oh, you know, we need some street psychologists or some people that can talk to our young people. The way they dress, you know, their pants are down to their knees. They're being destroyed. They're destroying. It's self-destructive. I mean, I know that's a rhetorical question, but I just want to get your ideas on that."
Yeah, I mean, I think, obviously things change across generations. I think one of the things that I come across is specifically looking at Black males is that in some cases it is the unhealthy coping things that we deal with. And it could be just like a minor stressor, like, somebody is dealing with. It doesn't have to be anything sort of serious, but in some cases it is like, it's easier for me to go drink or go buy a beer or something and consume that every day to like relieve some of this anxiety or stress that I'm dealing with, as opposed to try to go to therapy or to feel like I can go get support in that way. And so I think it is, again, for us to have more conversations about this, to really change the myth and narrative about what is involved in therapy and what therapy is. I sometimes, when I work with my kid clients, will say, therapy is like, I'm your coach. And I know that there's coaching programs out there now, but to the sense that if you're trying to learn to play a sport, you just don't like go to practice and go to the game. Like there's a lot of repetition that's involved in that. And so I try to let my kid clients know that therapy is similar like that. Like I'm going to give you some tools and skills to practice and work on. You're going to use those in your day-to-day life. And hopefully at some point it gets easier and you don't need me to be as directive to tell you like what you should do and how you should do it to sort of cope with things in your life. And so I think we have to change the narrative about what it means to go to therapy and get support, so that people don't think of it as like, well, I have to go into this office and sit on this couch and talk to this person about my feelings, and recognize that it can be very different than that sort of traditional method that people think about.
Well, I just see them as being self-medicating, but once you stop, the problem's still there.
Yeah, absolutely. Really good point.
Okay, thank you.
Okay, thank you, Dr. Green. And Dr. Turner, and since you were talking about, we all know that the toxic environment we're living in now, but it seems like this is going to be sustained stress, anxiety, trauma. So many times throughout the day, I observe so many recounts on LinkedIn, and these are corporate professionals. We're not even talking about the average everyday worker who we treasure and value also. Could you just talk about how we need to maintain the hopefulness, even though we're going to have to endure this a long time?
Yeah, absolutely. And so I think the other piece too is, I sort of touched on this briefly earlier. I know I talked about a lot of really heavy things, but the one thing that I mentioned was this idea about like joy, like really holding on to that sense of joy and hope. And yes, it's a lot of bad things that are happening. I had a conversation earlier today with some colleagues and professionals across the country in different professions about this and about mental health. And one thing that we brought up was like this idea, like we all need hope right now. Like people need to be hopeful. We can tell people to be hopeful, but they obviously need to believe it themselves. And so for me, I think the ways that I try to be hopeful for myself is realizing the power and the role that I can use my voice for things, especially as it relates to, the mental health profession, to like push back against some of these anti-DEI things that are going on, and to ensure that as a profession that we are also trying to advocate for people who need different things in society. And one of the ways that we can be hopeful is to engage in some type of action. And so for people to realize like you can do things to help address some of the concerns that are going on in societies. Yes, it can be hard, and sometimes you don't want to do it because it is hard. But the ways to move forward is being hopeful, taking some action, and to don't let people steal your joy, and figure out what ways that you can bring your joy to yourself. But one of the things that for me is trying to, at this point, like minimize the ways that I consume a lot of the news media, because I just don't even want to see some of the things in the news right now. I'll get pockets of it, but I don't need it to be coming at me every day and every couple of hours of the day. And people need to recognize when they can sort of be intentional about disconnecting to be with their families and friends and community. And that's a really important piece of addressing it and preventing how these things around us are sort of tearing us down.
Thank you. Mm-hmm. Thank you.
Dr. Lena.
Thank you, Dr. Green. Yeah, so Dr. Turner, you have highlighted in your presentation how Black men are often raised with the belief that showing vulnerability is a sign of weakness, and how it reinforces masculinity norms. So from my experience growing up in the Middle East, I've seen similar expectations placed on men, also that emphasizes invulnerability and emotional restraint. So given that masculinity norms seem to transcend racial and cultural boundaries, why do you think this expectation is particularly pronounced within the Black community in the US? What makes the Black male experiences unique, if you could please share?
Yeah, no, thank you for that question. And I do recognize that the ideas about masculinity norms are global, in terms of how men experience what those norms are and what expectations society places on us. I think, a lot of the research looking at masculinity norms show that Black men are I don't even know the best way to phrase this. They tend on measures of conforming to the masculinity norms, they tend to have higher levels of that compared to other groups. And so I think that is one piece of the puzzle. The other thing I think is sometimes for Black men in particular, that vulnerability is not adaptive. And so when you are adaptive in certain settings, what happens to you? And so I think men are very observant about those things. And if they're in an environment where vulnerability is not going to be beneficial to them, then they are going to sort of go back or revert back to that rigid expectation about not being vulnerable and not sharing their emotions. So I sort of mentioned the conversation about like romantic relationships earlier. And what I've seen and what I've heard, and maybe others can sort of relate to this, is that for some men, when they are vulnerable, whether that's talking about their feelings or whether it's being emotional and crying with their female partners, is that sometimes their partner's like, I don't know how I feel about this. He's sharing a little bit too much and those types of things. And so I think for men who do feel vulnerable and feel comfortable doing that, when they get that type of reaction, then it makes them much more likely to say, well, that wasn't something that worked for me in that setting. And so I'm not going to do that again. So I think that's just the nature of us as human beings. Like, we're reinforced by things in our environment. And so if this is the experience that I have, then I'm much more likely to not repeat that experience again.
Makes sense. Thank you so much.
Dr. Turner, as we draw to a close, I think one of the things that we have to own is the Black male experience in the United States is unique in the sense that it is anchored in a lot of trauma, and it's generational trauma. And there have been spaces where Black men could not, even in their space of wanting to be masculine and do the things that men are expected to do, we're not able to do that, in the space of, protecting your children or your spouse, that could get the whole family killed in some instances. And so I think that we have to own that there are still these triggers that are very much a part of the cultural landscape and the uniqueness of the Black experience in the United States that has often put Black males in a space of harm when they've sought to, not just be vulnerable, but to be honorable and protective in the spaces as well. And while that may not be some of the experience of a younger generation, it doesn't mean that trauma hasn't been passed on from generation to generation in some unverbalized way, but it's definitely been internalized. And I just want to know how we have to keep giving voice to that. And correct me if I'm wrong.
Yeah, no, absolutely. Thank you for sharing that. And I think the piece that I'll just say briefly is on the intergenerational trauma piece is that we know from research that changes your biology and the chemistry in your brain. So even though you haven't directly experienced that trauma, your parents may have experienced that trauma, your grandparents have experienced that trauma. That's in your DNA. So that gets transferred down to different generations. And so I think we do want to realize that, while people may not have had these direct experiences, their parents may have, but they've also lived in communities and spaces where they witnessed these things. And so that does have an impact, on individuals as well.
Yeah. So thank you so much for your time, for your research, for your work, for your insight. This, I think, was an amazing way to end our formalized celebration of Black History Month in the space of resilience and reclaiming our narrative so that we get to tell our story and the uniqueness of our story, but not have it erased because there are multiple pieces of our story. There's multiple truths that make us who we are. We hope that all of you that have been able to attend as many of the events have been well informed, have had a space of safety, have had a space of just good community. That is what we planned. That is what we always hope, that each event that we provide is a space where our students and our colleagues can come, can learn, can grow, but also where you can feel safe to engage and hopefully take some things back to the spaces where you work, where you study, where you live, and make a difference. As we end out Black History Month, we want to acknowledge the fact that the world is a crazy place right now, and that there is high anxiety, and that there's a lot going on. And I want to keep reiterating to you, as students, as people, as family, as extended family, as people of color and people from the diaspora, it is important to protect your peace. It's important to take care of you. It's important to connect with nature, to walk, to exercise, to clear your head, your heart, and your mind. And however that works in a healthy and helpful way to you, that you do that at all costs every single day. Watching stuff on repeat is not going to change what's going on. But getting rest, taking care of you, taking care of family, and figuring out what you can do in community in order to preserve not only your peace, but your life and support one another. Because the whole idea right now is to isolate people and to keep them overwhelmed. Don't allow that to be your response or your reality. We are indeed equipped better than we think we are to deal with this moment. This moment is not a new moment in our time and history. It's just new for us as an experience. And so I want to acknowledge that. I want to let you know that we all feel the palpable fear and craziness that's going on. We're concerned about not having paychecks. We're concerned about not having a social safety net. We're concerned about not being safe. We're concerned about not having allies. We're concerned about the insanity. However, in the midst of all of that, none of this has taken the divine or whoever you call on by surprise. And because we are still here, we are still breathing, that means that we have gifts for this moment that the world needs. And so we're not seeking to change the world. We're not seeking to right the ship that is sinking called the United States. what we're seeking to do is preserve our lives and the lives of those we are in community with, because we survive and we thrive in community, not as individuals. And so the more we can create safety in community, the more we can pull resources in community, the better we will fare in the midst of the insanity that is going on. It will take all of us doing this where we live, where we are, to make substantial changes. Change doesn't come overnight. We may not see this thing get right again in our lifetimes, but what we can do is lay bricks for the next generation. And so we thank Dr. Turner for helping us to think through how we do this with our Black males, starting with our Black male children, so that we have healthier beginnings. It's a whole lot easier to train a child up than it is to try to fix a broken adult. That's a whole lot harder. Then you have years of ingrained things that then you have to work through. So I do hope that for all that we've done this month, that you are taking away some important tools. I did place the book list in the chat. And so you have like 124 books that you can now stock your personal libraries. We hope that you will take seriously the message of this moment and this month to preserve your stories. So starting with your personal stories, but preserving our national and international stories as a people and the contributions we've made. We hope that that list helps you as you go and find other books to add to the list and put into your library, and to keep telling the story. And I'm going to turn it over to Lena before we do the benediction.
Wow, what a powerful and necessary closing to this year's Black History Month speaker series. A heartfelt thank you, Dr. Erlanger Turner, for sharing your expertise, your insights, and unwavering commitment to advancing mental health awareness and advocacy in Black communities. Tonight's discussion reminds us that reclaiming our narrative also means prioritizing wellness, truth, and healing. To make sure that the stories we tell include the importance of mental health, particularly for Black men. I also want to take a moment to express our deepest gratitude to Reverend Dr. Charlotta Green, who has not only moderated tonight's discussion with brilliance, but also led this year's Black History Month speaker series with vision, passion, and dedication. Thank you for curating such impactful conversations, Dr. Green, and ensuring that this series continues to educate, empower, and inspire. To our incredible team at the Center for Global Partnerships and Learning, led by our director, Dr. Gabriela Miramontes, thank you so much for your dedication in creating spaces where these essential stories and voices can be heard. And a special thank you to Dr. Ghazi for your ongoing support in making this happen. And finally, thank you to each and every one of you who attended, engaged, and contributed to these discussions throughout the months. Let's carry the lessons of this month forward to continue reclaiming our narratives, uplifting our communities, and advocating for justice, truth, and healing. We look forward to seeing you at future events. And until then, take care, have a wonderful evening, and let's turn it on to Dr. Green.
All right. Again, thank you for being here and giving up some of your time to be with us this evening. Thank you again to our presenter, who's given us so many wonderful nuggets of information. And so I leave you with this blessing. May the road rise to meet you. May the wind always be at your back. May the love of God surround you, and may peace and joy in the midst of the challenges well up in your soul and provide you the hope you need to continue the journey. Go. Be beautiful, loving, brilliant, supportive, grace-filled, loved, and transform your community one relationship at a time. Ashe, amen. Go in peace.
Amen. Thank you. Thank you, Reverend Dr. Green. Thank you, everyone. Have a wonderful evening.
Thank you.